Okay, so now we're gonna work on the legs and the quads. So make sure you have a little bit of lotion, spread it over the area. This one's really nice. You can kind of sit on the foot and then you can just work with the tool down this area. Once again, doing some sweeping strokes, and you're assessing, seeing if you can feel out where there's any little specific areas that feel adhered. And with Kate, I can feel right around here, there's a lot of adherence. Now, what's really cool with this tool actually is when you're working along the quads, you can also work in the IT band. Of course, working over the IT band is not the most fruitful thing that you can do, but you can work just off to the side of it, and that helps with a lot of tension that people feel in this area. Also, if someone has patellofemoral syndrome, you can work the lateral knee along this area, and that will be really nice to alleviate that as well. So you can sweep down the leg. And once again, I'm feeling right here, so I'm going to brush in that area where I feel the adherence. And we're going to brush all around it, different angles. And then I will sweep along. And I can feel that it's moving a lot better after that simple little treatment. Now you can work across the IT band. I can bring her leg across and then work down beside the IT band, which is a really nice technique, and you can brush as she's moving her leg to the side. And then you could work over the IT band, and you could scan for any areas where it might be particularly tight or adhered along that path. And once again, she's very tight up in this area, so I'll do a little more treatment to that area. We can also do kind of a muscle energy technique here. So we've worked through the tissue, it started to loosen up a bit. So now I can get Kate to press into my hand with her quad for 10 seconds with 20% force. And then I'll get her to relax, take a second, and get her to take a deep breath in. And then I can stand up, and I'm gonna instruct Kate that I'm gonna bring her leg out. So I'm gonna bring her leg out, and as I do that, you can work through the quadricep muscle with some brief strokes. And then you can transition the treatment into working on the leg from this angle. So once again, get creative with your techniques. Think of different ways that you can mix this tool in with your hands-on techniques and some very nice stretching techniques like muscle energy techniques. It's a really great way to go about increasing range of motion and kind of changing the brain's response to this particular area. Another really great way to treat this area is to get the client inside lying, and then you can work around the hip, the glutes, piriformis, all in this position. So sometimes, if you're draping the client, it'll be a bit easier. She has shorts on, a little bit harder. But still, you can work around the hip and do some sweeping techniques. You can sweep down the IT band, and then you could work and brush down either side of the IT band, which is really nice for kind of alleviating and opening up the tissue around this area, which is really going to be good for anyone who has patellofemoral syndrome due to the connection fascially between this line. So make sure that you work. You can even take the tissue with your hand and kind of spread it back like this, and then you can work on the IT band just off of it, going down towards the knee, lightening your pressure as you get closer to the knee. You could even do a fanning stroke, which is really nice. And you're going down the tissue in the side lying position. Make sure you go down both sides. You could theoretically work into the hamstrings from this angle, which is another great treatment option. And around the greater trochanter, it's really nice to break up all of the little adherences in all directions around the hip. You have to change your angle. And we're just brushing along there. And recognizing the importance of all the attachment sites that go into the greater trochanter, and how sometimes it's hard to get those little specific adherences when you don't have a tool. So using the tool to your advantage in this area is really nice for the hip. And then just finishing off with some broad strokes down the side of the leg. You can even work into kind of TFL area in this position. If they were undraped, you could work along the glutes. You can even work over the shorts and just do some techniques over the piriformis in this position. Once again, I find with the piriformis is really nice to work multi-directionally. So you can go like this and work along, and then you could work in different directions, up and down, back and forth, and just continuing to try different ways of treating this area. So now we're going to work on the hamstrings, and I'm placing a little bit of lotion down. And then there's a lot of really cool and interesting techniques you can use for the hamstrings. But basically you want to start once again with the scanning, and we're assessing. We're looking to see where things might be adhered. And with Kate, I can feel that right around here, there's a little bit of an issue. So we're going to go in and really do more of a focused treatment on that area. And it's feeling better. You can brush around that area. And we're really opening everything up around that tissue, and then do a sweeping stroke. Another cool thing you can do here is get them to bring their leg up, and you can do kind of like a pin and stretch here. So I'm moving her leg down as I move through the tissue. Once again, moving her leg down and then going through the hamstrings. With the hamstrings, it's also important to note that you've got the biceps femoris and the semitendinosus, semimembranosus. Sometimes when people are really tense in this area, everything becomes kind of glommed together in this specific area. So you can take your tool wherever you feel like there's this really attached, kind of sticky kind of feeling. And then what you can do is take the tool like this, find where that sticky kind of tissue is, and then I can kind of anchor down, and then I can slowly bring her, shorten the tissue a bit, do a bit of a positional release technique. I can come around and really find it more specifically with the edge of the tool. And then, so you can feel right about here, and then you can shorten the tissue, and then you can outstretch it as you're brushing through. You can even just hold it there and then get them to slowly bring their leg down as you kind of pin it up and stretch it up like that. So I'm using the tool, I'm pinning it down in the shortened position, and then I'm getting her to lengthen her leg. And as she does that, I'm pinning and stretching up. After you've done that, you can brush down that area that you specifically worked on, fan out, work it in different directions, and make sure that everything feels like it's moving a little bit better. So I'll assess again, and as I assess and get a little more specific, I can feel that this area is a lot better, and that's when you know that you most likely do not need to treat anymore. And once the client's off the table, you can get them to see how their range of motion is, see if they can touch their toes, maybe they have a little more stretch, and they're feeling kind of relaxed in this area. Okay, so I'm gonna show you guys an alternative technique for the hamstrings that I think is really cool, and it works really well. And it's also nice to combine with a muscle energy technique. So I'm gonna get Kate to bring her leg on my shoulder. And then what you can do here, which is really nice, is just take the tool and work down like this. And what's really cool about this position is that you can work around everywhere. So I can work in the quad, I can work around the knee, I can work in the hamstring, you can work in the adductors, be careful, be sensitive. And then you could also work down the tib anterior. So I really like this, and it's one that I do. Maybe better for physios, but massage therapists can do this as well. So take the tool, angle it at about a 45-degree angle, work down the hamstrings in this position. And then once again, you can kind of shorten the tissue like that and work down the hamstrings. This is a really nice way. And you're just kind of sweeping down. You could even get closer to the kind of ischial tuberosity. So you're just working down that way. And then you could do a muscle energy technique. So I can get Kate to press her leg down into my shoulder. So she's pressing down into my shoulder. She's using 20% of her force. And then I can get her to relax. And then as she relaxes, I'll get her to take a deep breath in. And then on the out breath, I'm going to raise up my body, raising her leg, and then I'm going to sweep down with the tool. So I'll anchor down with the tool, and then I'm sweeping down as I raise her leg. Her hamstrings are very tight, so this is difficult to do. But another nice way to incorporate muscle energy techniques into this treatment.